Okay, we are going to look into the practical CNS2 images first. First of all, this two image is going to show features of cerebral atrophy. So you can actually look from the lateral view as well as the coronal view. Okay, and you can actually see two main features: the sulci, which is the grooves, and the gyri. Okay, and you can actually notice that the whole brain is basically smaller, right? And most importantly, the gyri is become narrowed, okay, and the sulci is become widened, okay. So this is basically an opposite of cerebral edema, okay. And if you look into the coronal view again, you can actually obviously see the gyri is actually narrowed and the sulci becomes so wide, okay. Next, we are going to look into Parkinson's disease. First of all, this is the normal subsection nigra, and this is the patient's subsection nigra section. The normal one, because of subsection nigra has a lot of dopamine, it has this pigmentation, and in the patient's area, the pigmentation become much less. Next is we are going to look into tumor of the brain. This is glioblastoma, the high-grade tumor of the brain. Okay, you can see there's a tumor there, right? Okay, most evidently, because this is high-grade tumor, similar to malignant tumor, you can actually see that the margin is not well demarcated, okay? And because of that, it does not have well-formed capsule, and the areas, the cut section is heterogeneous, okay, with areas of hemorrhage, because it's red, and the yellow one is necrosis, okay. Next, we are going to look into the most common primary tumor of the brain. This is meningioma. As the name says, this is actually a tumor that originate from the meninges. This is actually the dura or the meninges layer of the brain, and from that there's actually a tumor that arises from it, okay. This is a low-grade tumor, or also can be said as benign tumor, and this is because of the margin is actually well circumscribed, and when we do cut it, you can actually see capsule, okay. And apart from capsule, we can also see areas of compared to glioblastoma, it is homogeneous, right, with no areas of necrosis or hemorrhage, none of them, okay. Apart from that, most importantly, as you can see here, the tumor grows compressing towards the brain matter, and it causes what we call as indentation, okay. So this indentation is actually quite common in meningioma. Next, we are going to look into Schwannoma, the most common primary benign tumor of the peripheral nerve. Because of its benign, you can actually see that the margin is well circumscribed, okay, and you can actually somehow appreciate there's actually capsule there, okay. The cross section is actually homogeneous, okay, homogeneous with no areas of necrosis as well as hemorrhage and hand hemorrhage, okay. And you can actually see this is actually the nerve ending, okay. Next, we are going to look into virtual microscopy. The first slide is slides on Parkinson's disease. This is section of the hippocampus. This is actually the hippocampus, and from here is as well you can see the gray matter and the white matter, because neurons are basically majority in here. There's lots of myelin sheath causes it to give color of white, and the area that we are going to look is actually the neuron cells. Okay, and when you focus on that area, what you can see is all this nucleus. But what's peculiar about this nucleus is the cytoplasm of it becomes so condensed. Okay, you can actually see this is actually the nucleus, and this is the condensed cytoplasm. Okay, this is due to collection of tau protein, and this is what we call as neurofibrillary tangles. Okay. Next, we are going to look into Parkinson's disease. Again, this is the area of hippocampus. Okay, and you can actually see this is the white matter and gray matter. The problem is in the neurons of in the white matter, and if you zoom into that area, okay, this area, okay, you can actually see the nucleus. These are the nucleus of the neurons. Okay, you can actually see in the nucleus there's actually inclusion there. Okay, here inclusions. Okay, and you can actually see the some of the cells are brownish, and this is because of the presence of the dopamine. Okay, dopamine granules inside the cytoplasm of the nucleus. But most importantly, what happened is in the cytoplasm, presence of these inclusions. All right, these inclusions are known as Lewy body, or bodies, because there's more than one. Okay. Next, we are going to look into the tumor. First is glioblastoma. Okay, you know this is brain because of the gray matter and white matter again, but there's actually something is happening there. If you look into high power, most importantly, the cells that you look into here is actually more than normal amount of cells in white matter. This is actually all the glial cells proliferation, and these glial cells or astrocytes basically are large. Okay, and at the same time it is actually having pleomorphism, hyperchromatism, and sometimes you can actually see mitosis, and that's the reason why all of these are features of atypical astrocytes. Okay, next, most importantly, is actually the peculiar features of glioblastoma. The cells are arranged in a formation that almost looking like it is actually palisading, but it is not a real palisade. So this is what we call as pseudo-palisading. This is area of pseudo-palisading. This is area of pseudo-palisading. Okay, and most importantly, because this is a high-grade tumor, you can actually see the whole area is composed of necrosis. Okay, necrosis. And again, because this is high-grade tumor, it also has a lot of blood vessels proliferations, and this is features of glioblastoma. Next, we are going to look into meningioma. Okay, so when you first open the virtual image, this is the slide. Okay, and when you focus on this area there, okay, you can actually see the cells are actually spindle cells. Okay, because this is actually meningotellar cells, and it's actually arranged in a whorl pattern. Okay, whorl pattern, right? And this pattern is typical for meningioma, And apart from that, if we look into this area and this area, as well as this area, you can actually see the classification eccentric classification known as Schwannoma body. Okay, with more than one Schwannoma bodies, right? Okay. Next, last one, we're going to look into the benign tumor of the peripheral nerve, Schwannoma. And from the low power, you can already see the cellular area, the dark pink area and the light pink area. The dark pink area has a lot more cells or nucleus, and that's the reason why it is actually hypercellular compared to this area, which is hypocellular. And the hypercellular area is known as Anthony A area, and the hypocellular area is known as Anthony B area. Okay. Another features of Schwannoma, because it is known that Schwann cells are actually spindle cells, right? But most importantly, this forms a true palisade. Okay, it forms true palisade. But what's important is these palisades actually face one another. Okay, and this configuration is known as Verroque body. Okay, so please look into this area for Verroque body. Okay, that's all. Thank you.